Hi everyone, I'm Greg Viss. I'm the founder of SimVS and thrilled to be here at Sim & Skills World Headquarters in lovely Chesterfield. We're happy to be able to show you our product range today, a selection of our product range, and we're showing our suite here that surrounds the bedside with both therapeutic devices such as an IV pump or a defibrillator, communication devices such as our nurse call system, and also monitoring systems for assessment. We have a wide range of monitoring systems which we'll take a closer look at. Now all of our products are very simple to use and with strong connectivity, also economical. So you can take a low fidelity mannequin and using our system, increase the fidelity and realism of this. And that's what we'd like to show you a little bit more. This is the SimVS IV system, the world's first infusion pump simulator. As we know, training on pumps is very complex, but also filled with anxiety for faculty and students. And our goal is to make learning IV as simple as possible to help reduce the errors. And what we found for that is practice, practice, practice. So this system allows students independently or instructor control to practice programming an IV pump. So let's take a look. We have 6 different interfaces of pumps. We'll take a look at them, but these are the most popular pump interfaces on the market today. We also have a PCA system, and we have a universal pump that kind of replicates the direction that pumps are going. But let's take a look at our Infusomat, and you'll see how these pumps work. All right, so the skins look exactly like the originals, and the pumps work, the buttons work exactly like the originals too. So for this one, I will turn the power on. We'll follow the directions. We'll go OK to begin. It'll ask us, is this a new patient? We'll press yes. A new therapy, yes as well. What category? We'll do an adult medication today. And let's go down. You can see partial list of the drug library. We'll pick a simple one. We'll just do a volume infusion right now. So we'll go with IV fluid. And on this one, we set the rate. So I will set the rate here to 100. And that's okay. We can review before we start the pump and start it. And there it's going. With this, we also have the option to accelerate it if you're doing different scenarios. And we can create volume, weight-based, and dose-based medication administration. Now, we've started to gamify the system. And one of the features for gamification is before they start, we offer this checklist. It's kind of like a speed bump to make sure that they've checked all the boxes that they should to ensure patient safety. Right patient, right medication, right route, and other things too. So let's go through that quickly. So, pause the infusion, check the IV line, etc., etc. And this is very popular too. Now, one of the things that makes this unique is a lot of programs are probably using refurbished pumps. They're convenient, they're cheap, however, many of them require maintenance, and some of the things that don't work on them are the drug library. With our solution, you have complete control over the drug library, and including able to create guardrails. So we'll take a quick look at that. So what that allows you to do is put your whole formulary in there. It comes with a preloaded formulary of the most common IV infusions, but you can also add any specialized ones you'd like. So let's take a look at that. So here's an idea about our drug categories. And if we wanted to, we can add a new drug here. So we simply select what type, the name, the amount that's in the bag volume, and then our guardrail features such as a dose limit, rate limit, and volume limit. And so it offers this flexibility, which is so you don't have to send it out for maintenance, very convenient that way. Now, as I mentioned before, the system can work in 2 modes. It can work in autonomous mode, where the tablets are handed to the student and they can practice, or it can also be done in instructor-led mode. In instructor-led mode, the instructor can send medication errors over to the student and can also send med orders over to the student. Now let's take a look at our nurse call communication system. So the nurse call communication system allows you to easily mount a nurse call system on any existing head wall, and it's not a permanent mount, but it can be mounted on any head wall. You could have up to 20 different nurse call head walls controlled by one instructor system. So it's very flexible that way. You know, if you need one or up to 20, we can, configure a custom solution for your lab. So what this allows us to do is the instructor can send a code to the bed saying there's an emergency going on, or at the bedside, they also have the opportunity to call for help. And we know code blue is not used in the UK. We are going to be coming up with a custom Sim & Skills version of this with the correct alarms. So it's a two-way communication system. Another thing that we have that's very unique is we have push-to-talk walkie-talkie. So from the bedside, you can press the walkie-talkie and talk to the nurse station, and vice versa. At the nurse station, if they want to send you a message, they can press their walkie-talkie and you'll hear it at the bedside. So this system is great. So we also have two-way communication. We're tracking when the alarm was sent, when it was responded to. We can do multi-patient coordination scenarios with this. So it's one of our very popular systems as well. Now we'd like to show you our SimVS hospital system. This is our most advanced system. What this system allows us to do is replicate different types of monitors controlled by an instructor tablet. So we have a range of monitor types. We have a hospital monitor, defibrillator, mechanical ventilator, and fetal heart monitor. And these can be run, multiple tablets as we showed before. We will start with the hospital monitor. So I'll select that. Now here on the instructor tablet, it brings up our scenario library. We have a strong scenario library covering the lifespan and different conditions. So I've opened the scenario library here, and as you can see, we have a wide range of pre-programmed scenarios. The system has these pre-programmed scenarios. You can run it on the fly, changing the physiology virtually, instantly, or you can also create your own scenarios quickly and easily. But let's take a look at the range of scenarios here. So we have adult, we cover the lifespan, newborn, obstetrics, and pediatric, and geriatric scenarios. So the lifespan is covered. We also have cardiac scenarios and medical scenarios, trauma scenarios, so a very comprehensive mix. Let's now look at the different monitor types and how we're going to work with them. So here I will select a defibrillator. Let's go with the hospital monitor. Okay, so now both of our tablets are ready, and this shows one of the features of SimVS, that we can do multiple patients running up to 6 scenarios at the same time. It's rather complex, but it offers a number of flexibility. So you could have a lab with 6 beds, each bed running a different scenario. So let's take a look at this. We'll start with a simple scenario. So we'll do congestive heart failure. This is the instructor controls, which is if you work with a mannequin, you're used to controlling the physiology from a laptop. This is similar. All right, so here are the stages of the scenario. So we'll just go with the start. All the physiology loads up. Now I will go ahead and send it over to the student tablets. We can see that that's instant. And then let's make some changes here. So we'll change the cardiac rhythm. We'll go with AFib. And now we've changed the cardiac rhythm. So let me show that to you again. So we have a wide range of rhythms to select from as well. Most of your common rhythms are in there. Now in terms of the physiology, this is the preset, but we also have the flexibility to very quickly change any of the values and send those, and we can see that we have an instant change right there. So it's a very powerful system. Again, we talked about the nurse call, but sending the nurse call signals happens here. We select which bed we want to, and then we send the signal over. So it's all integrated. So one system controls everything, including the IV pump, which we looked at before. Now, so those are the example of the preset scenarios. Here you can see the two-way communication that an alarm has been sent. Now, some of the other features on here is we can create trends. So instead of going state to state, we can have the physiology very slowly change in a trend. We would set that here. Another feature that's very popular is you have the ability to create your own checklists. Okay, so as the students are performing the scenario, we can see if they did the required actions, and you could put, here we have yes, no, that could be a 1 to 10 scale, many things, you can change it, but what's nice about this is it's time stamped. You can add any performance notes that you would like, and then at the end for your debriefing, here's a summary that can be printed or shared with the group. Now, one of the ways that the system is being used is in the classroom. Here we're showing in the lab. But these monitors can be hooked up to a projector, and you can have, scenarios in the classroom with everyone. Let's take a look at our telemetry app. And telemetry app is, just as we say, allows you to track multiple patients at the same time. So again, here we'll pick one scenario. We'll go here. So now they're all the same, but we can customize this. So we're going to go with a 4-patient layout, and we are going to do that. Okay, so here we got patient, so that's patient 1, here's patient 2. We'll select a different physiology, or actually I will give them a different cardiac rhythm and send that over. We'll take a look at our mechanical ventilator. This was the first mechanical ventilator, tablet-based, on the market, came out in 2019. It's our most advanced simulator. And so we'll select it on the instructor. Here's our respiratory curriculum. The most common respiratory conditions are included here. Let's take a look at a simple one. We'll just take a look at a head trauma scenario. And so we can, again, the concept of operations is the same, except on this one we control both the physiology and we control the lung physiology. So I'll show you that. So here, again, the physiology is displayed. If we're good with that, we send it over to the student tablet, and we see a very quick display. These are dynamic waves, so you make your changes and the changes are instantly reflected. We'll show that. But here we can see we have our pressure, flow, and volume waves, and all your standard values right there. So now we'll go ahead and take a look. If we wanted to change the resistance, that's going to change the waveform. We'll see that instantly. So here we're getting a little bit of air trapping, so we can see the changes are instant. The pressure went up. So, those compliance and resistance changes are instant. Same thing, tidal volume, respiratory rate, PEEP, and inspiratory time can all be set as well too. So we operate this one through different scenarios, and this comes with a comprehensive instructor's manual, but basically the scenarios, question, answer. We send media over to the student. The students can see what the problem they're dealing with, and then after that we are going to send them a question. So here is the question to the students, and then they can go from there. So that's a quick look at the mechanical ventilator. Now let's take a look at our final monitor, the fetal heart monitor. We'll come to the instructor, we'll select the fetal heart monitor. Here's our target student tablet. Select the fetal monitor. We're ready to start. Again, a curriculum. So a comprehensive curriculum of the most common conditions for labor and delivery. Let's take a look at shoulder dystocia. When we look at shoulder dystocia, you can see we have different parts that control the different phases of labor and delivery. Now, this top part is going to control the fetal part, and this is the contractions for the mother. Again, the signal is sent, and the waveforms will start to be generated. So you have the ability to control the fetal heart rate, the heart patterns, the contraction frequency, duration, and intensity, all reflected here. We also show the mother's physiology here. So if you did want to make any changes, if the mother's in distress, we can adjust the mother's physiology and show that. So one of the nice features with this too is, labor and delivery, as we know, can take a long time, but your scenarios need to be compressed. We have a feature here where we can make them run 10 times faster, up to 10 times faster, so we'll see the waveform accelerate. Now again, as I mentioned, these tablets can be hooked up to a projector and shown in the classroom, and that's a very popular way of showing different concepts here. So that's a brief overview of our product line, and we would invite you to get in touch with Sim & Skills for further exploration, and we look forward to working with you on this.